If you are new to Medicare or enrolling in Medicare very soon, you probably have realized there are a lot of different Medicare plan options available. One of them is Medigap insurance. Then you might be asking, well, what is a Medicare Supplement Plan? Well, they're the same thing, but don't worry, I'm going to make this video very easy and quick to help you learn if a Medicare Supplement Plan is the best choice for you. So the easiest way to begin learning is to first cover what Medicare actually is and how it works. And it's very simple. As I mentioned, I'd make it easy. Medicare has various parts to it. The two main parts are Medicare Part A and Medicare Part B. So you will be enrolled in those. If you're drawing a Social Security check, you'll be enrolled automatically. They'll send you your card in the mail 3 months before your 65th birthday and let you know you're enrolled in both of those. However, some people want to keep working and they have employer group insurance, in which case, if you're not drawing a Social Security check, you'll go online to SSA.gov, the Social Security website, and you can enroll in just Part A and let them know you're going to hold off on Medicare Part B because you have what's called credible coverage. Now, Part A covers hospitalization and Part B covers doctor services. These don't cover all of your bills. You might be asking, well, what about Medicare prescription drug plans? Yes, those are not included in those. You would have to enroll in one of those separately. However, we're going to focus on what is a Medicare supplement plan because that plan will work right alongside Medicare Part A and Part B to pay most of your medical bills for you. Not bad. So as I mentioned, Medicare Part A and Part B do not cover all of your medical bills. Well, what don't they cover? Well, there's things like deductibles, coinsurance, as well as copays that are not covered under those. Those are called gaps. So if you've ever heard the term Medigap, of course you probably have, a Medigap helps pay for most of those expenses, in some cases all of them. So a Medicare Supplement Plan and Medigap, like I mentioned, are the same thing, and they help to pay the gaps or expenses in Medicare Part A and B that you're required to pay. Starting with Medicare Part A, one of those expenses or gaps would be the Part A deductible. What this means, remember, Part A is hospital insurance. If you go into the hospital, you need to pay a deductible, or your Medicare Supplement Plan will pay the deductible for you. Now, the thing with Part A is that's not just a one-time deductible. If you go into the hospital, you need to pay the deductible. If you leave for 60 days or more in any year, and you go back into the hospital, you have to pay the deductible again. So these gaps can really add up, particularly with Medicare Part A. Now, on the Part B side, remember that's doctor services. That also has a deductible. It's once per year. It's called the Medicare Annual Part B deductible. And what that means is once you go to the doctor anytime throughout the calendar year, Medicare is not going to not begin paying any of your medical bills until you pay the annual Part B deductible. Now, we're here in 2023, that deductible amount is $226. This means you're going to get billed up to $226, and then Medicare will come in, but Medicare is only going to pay 80% of your bills. The extra 20% you're required to pay. That's another gap. That is an expense called coinsurance that you're required to pay. The more popular Medicare supplement plans, however, will pay that for you. But I'll get into the details of each plan here in a moment. The most important thing to remember is each Medicare Part A and Part B, has these gaps or expenses that you're required to pay, and that's where a Medicare supplement plan can come in and help you out. As I mentioned, there is Medicare Part A and Part B. There is also what's called a Medicare Part D. That is a prescription drug plan. So again, that's separate, and I will touch on that in a little bit, but that is an entirely different part. But then we move on to the Medicare supplement plans themselves, and they also have letters, just to make it a little more confusing for you. However, my job is to make it easy for you. So, Medicare supplement plans are designated in letters. They run A through N. There really are just a few popular plans that most people enroll in, so that helps make it easy as well. Now, A through N are the letters. It doesn't mean the coverage gets better as you go through the alphabet. In fact, it's quite different than that. So, the most popular Medicare supplement plan letters are Medicare Plan F, Medicare Plan G, Medicare Plan N, and then a high-deductible version of Plan G. These plans are what are called standardized plans. This means that the government has said, Okay, insurance companies, you can offer these plans, that's fine, but nobody can have different coverage. So for example, the more popular plans, say Plan G or Plan N, if a Plan G is offered by one company, the benefits are identical if another company offers it, and they do. So Plan G is the same, Plan N is the same, it does not matter. The plans are standardized. They all have the same coverage no matter which company offers them. However, they all have different rates. Entirely different rates, which is why we do what we do. We help people shop for the lowest rates for the Medicare Supplement Plan. Now, our phone number is down below. As you can see, you can call us anytime during this video or after this video, and we'd love to help answer all your questions on this because we know it can get very confusing. But again, remember this, Medicare Supplement Plans offered by a variety of different companies, several in each state. They all have the same coverage, but they all charge different rates for it. So as I mentioned, there are a number of different plans to choose from, or plan letters, and a number of different insurance companies who offer them. But again, back to those 4 most popular plans, those are the ones that probably 95% of the people out there enroll in. And I'll go over the differences of those now. We will start with Medicare Supplement Plan F. Now, Plan F is only available to people who are enrolled in Medicare prior to January 1st of 2020. So if you are watching this, chances are you already know what a Medicare Supplement Plan is. If you have one, I hope you do. Well, you probably already have Plan F or maybe one of the other plans if you were enrolled in Medicare prior to January 1 of 2020. Anybody enrolled after that is not allowed to get a Plan F, but don't worry, there are some other great choices, in fact, choices that will save you money over Plan F. But Plan F became so popular, and as a matter of fact, the most popular Medicare supplement plan of all time, because it pays everything 100%. So all those gaps I mentioned for Medicare Part A and Part B, the deductibles, the copays, and the coinsurance are all paid 100% by Plan F. As you can imagine, it's the most expensive plan, but boy, what great coverage. Go in, show your card, and go home and never get a bill. Now, that's one of the reasons they actually eliminated it and don't allow people to enroll in that plan now if you're new to Medicare. But if you still have a Plan F and you are out there, and for some reason you're watching this video wondering what a Medicare supplement plan is, there's a good chance we could save you money by switching to a different company. You will have to go through medical underwriting, but we are changing our clients from one Plan F to another sometimes once a year just to keep saving them money. So keep that in mind. You can still change to a different Plan F if you do in fact still have a Medicare Supplement Plan F. But as I said, you folks who are new to Medicare, you're wondering what a Medicare Supplement Plan is because you have not enrolled yet, there's another great option that you certainly can look at, and that is Medicare Supplement Plan G. Plan G is now becoming the most popular plan because Plan F is no longer available, and that's because it's got great coverage. It's very close to Medicare Supplement Plan F. And the fact with Plan G, remember I mentioned one of the gaps was the Part B deductible. Part B is doctor services, and you need to pay this deductible before Medicare comes in and starts paying. Well, on Plan G, you pay that deductible yourself. Plan F pays it for those people, but again, not available for people new to Medicare. You just simply pay the Medicare Part B deductible, and in 2023, it's $226. Last year, it was $233. So once that deductible is met, Medicare will come in, pay 80% of your bills, and Plan G will come in and pay the remaining 100%, just like Plan F does. But the benefit of Plan G, and why I said it would be a better option for you folks who are new to Medicare, is it's lower in premiums than Plan F. In fact, lower than the deductible amount. So you will save money, and actually, for the people on Plan F, they're paying far more than the deductible amount just to get it paid for them, where you just write the check yourself and you save the money on the premiums. But you still get that 100% coverage once that deductible is met. Now, if you visit my website, Medisupps.com, you're interested in Plan G, we show you the rates. We're one of the only companies out there that will actually show you the rates for Medicare Plan G and Plan F and Plan N, actually. So you'll get a great idea of the kind of savings that you can have from a couple of different companies on there. You'll see the differences in premiums, as I mentioned, for Medicare Supplement Plan G. But it's a great plan, and the reason it's the most popular is that outstanding coverage. One small deductible, then get everything 100% paid. So the remaining Medicare supplement plan that we'll talk about is Medicare High-deductible Plan G. Remember, we had that standard Plan G we talked about where there was just one small deductible, $226 in 2023, and then 100% coverage. Well, there is a high-deductible version of that. Not as popular as the other plans because most people don't want to run up a high deductible, keep getting bills, and then their coverage begins. However, it is an option. Now, how is it different than standard Plan G? Well, you still pay the annual Part B deductible with the high deductible plan. That's actually a Medicare deductible. That's why you hear me say on every plan you have to pay it except Plan F. Everybody's got to pay that, whether you have a supplement plan or not. Well, once you meet the annual Part B deductible with the high deductible plan, Medicare will come in like it does every other plan and pay 80% of your medical bills. So you're still responsible for the 20% of every medical bill up to the high deductible amount. And in 2023, that deductible amount is $2,700. So in other words, you pay the first Part B deductible of $226. After that, Medicare comes in, pays 80%. You pay the remaining 20% up to $2,700. After that, you will get 100% coverage because Medicare will then pay the 80% and the high deductible Plan G will pick up every remaining bill. Now, what are the benefits of this? Well, nice low premium. These premiums start very, very low, much lower than a standard Plan G. And a lot of people do like that, particularly people who don't go to the doctor very often. I have people call me and say, Russell, I never go to the doctor. I don't want to pay a higher premium on a plan. Just give me the bare minimum. That would be the high deductible Plan G. After that $2,700 is met, again, 100% coverage, so they're not worried. If something major happens, God forbid, a major medical illness or an accident, well, they only have to pay $2,700. That's per calendar year. Everything resets every calendar year. So that might fit your needs very well, and I hope the explanation of each of these and determining what is a Medicare supplement plan helped you out in this video. Now, again, we're an independent agency. We've been doing this 15 years now. We have thousands of clients, and we'd love to help you out as well, even if it's just answering your questions. We do that all day long for people. Our service is entirely free. You can give us a call at the phone number down below. It is 1-888-891-0229. And again, you can always visit my website. It's Medisupps.com, where we offer free quotes to allow you to see the rates on these plans and help you determine which is best. But we can help you out as we do all of our clients now and for years to come to save you the most money possible. So give us a call today. I promise you'll be glad you did.